This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. We can do our daily activities because of the heart. The heart is the organ responsible for circulating blood throughout the body. But when the heart works harder than normal to distribute blood through the blood vessels, this can be due to hypertension. Hypertension or high blood pressure is a chronic medical condition wherein the blood pressure in the arteries rises.
For a person to be hypertensive, he or she needs to have a blood pressure of greater than 140/90, consistent na blood pressure. Na high blood pressure does not mean na nahirapan siya mag-pump ng blood, pero it needs to pump at a higher pressure para ma-meet yung requirement.
According to the Department of Health, 1 out of 4 Filipino adults suffer from hypertension.
Hypertension is more commonly associated with the older population, but it's not impossible for the young people to have hypertension, especially if the young person has these risk factors.
Contrary to popular belief, hypertension can also be encountered by young people, just like the 28-year-old telecom sector representative, Alfred Menes.
It's a fast-pacing company. Every day, we usually go home around 7 o'clock, 8 o'clock. It's very stressful. I eat a lot during stress time.
Apart from obesity, other causes of hypertension may include smoking, diabetes, stress, and lack of physical activity. What are the signs and symptoms of hypertension? Are there available treatments for this condition? Which food to avoid to help lessen the risk of high blood pressure? All these and more tonight on MedTalk. To help us tonight in our discussion is Dr. Nick Cruz, interventional cardiologist and director of the Heart Institute at the St. Luke's Global City. Also with us is Dr. Maria Adelaida Ebolion D., cardiologist and assistant medical director for medical education at the St. Luke's Medical Center, Quezon City, and head of the Women's Heart Health Unit at St. Luke's Global City. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post in our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Hi, Angel.
Good evening, Angel.
You know, we try to fit in our daily activities in 24 hours, if we can, or less. And we don't realize that it takes a toll on our body, most especially our heart. And then when we feel that there's something wrong, we experience something wrong, then it may lead, or others may say that it can be hypertension. So what exactly is hypertension? Doc Lenny, Doc Nick?
Well, by definition, in layman's term, hypertension is actually the pressure that the blood exerts on the walls of the arteries. So we have two numbers with it, the systolic and the diastolic. So when you say blood pressure, there are two numbers, the top and the bottom. So the top number, or the systolic blood pressure, is the pressure that's exerted when the heart beats. And the bottom number, the diastolic blood pressure, is the blood pressure exerted in between beats, or when the heart is actually rested. Simply put. So when you have blood pressure elevation, as your video showed earlier, these are blood pressures greater than or equal to 140 systolic, or the top number, over a 90 millimeter mercury diastolic blood pressure. So a blood pressure greater than or equal to that is labeled as hypertension.
Hypertension already. How about the difference between blood pressure and, you mentioned earlier, beats, like blood pressure and heart rate? And are they related?
You want me to answer? Heart rate is the number of beats the heart beats per minute, while blood pressure is the pressure that it exerts against the artery. So they're related by a certain equation, which actually leads to what we call a cardiac output, a little bit technical, but yes, they are, because it's the pressure exerted by this beating of the heart. But there are actually two separate parameters for looking at the function of the heart.
And when we talk about the function of the heart and the number, the systolic and diastolic, what about the measure of one who has hypertension or one who has already been suffering from hypertension?
In terms of measurement, as we said, it's 140 over 90, greater than or equal to it, but not on a first instance.
Okay, I thought the first instance.
It's important to note that by definition, aside from the number, you should have at least two separate occasions when you get a consistent reading of blood pressures greater than or equal to 140 over 90. All right, on two separate occasions, some say at least 2 weeks apart, but not necessarily. So when you have consistent readings greater than that, that's labeled as hypertension already.
And if I may add, the environment has to be relaxed. So you should not take the blood pressure of a patient who just comes in. No? Let the patient relax first. The room should be relaxed also, or relaxing and quiet. The patient should not have had any smoke within the last 30 minutes, because sometimes smoking may give you temporary rise in blood pressure.
Caffeine? No?
Caffeine also.
Coffee, Coke within the last half hour before he sees you.
Right. So it's important that the patient is relaxed, seated, and then that's the correct technical way of taking the blood pressure. Now, if at two occasions the blood pressure is always more than 140 over 90, then the patient is termed as hypertensive.
Already. You mentioned the word relaxed, and we mentioned the hypertensive 140 over 90. How about a normal blood pressure when one is relaxed, when one hasn't had smoke, or when one hasn't had caffeine or alcohol? What is the normal blood pressure?
So actually now there's what we call as normal. There's also a category called pre-hypertensive already. You know? So this term was coined in the last guidelines, and it was maybe about 6-7 years ago. Normal blood pressure, well, to answer your question first, should be a blood pressure technically before any blood pressure less than 140 over 90. If you say hypertension is 140 over 90 or greater, then a blood pressure lower than that is labeled as normal. Technically. But now they say normal or optimum, or the best blood pressure that you can get should be a blood pressure less than 120 systolic over 80 diastolic, or less than 80 diastolic. And the levels in between that, the range, is what we label now as pre-hypertensive. Okay. So pre-hypertensive now is a new category added, seemingly like you're borderline hypertensive already. Okay, so that puts you more on guard. In terms of
there are also special patient populations that would be labeled as hypertensive if their blood pressure is 135 over 85, for instance. These are patients who are at higher risk for complications of high blood pressure, and this would be the diabetics and those who have kidney problems or kidney disease.
So you mentioned this, those who have diabetes and kidney problems, which leads us to the classifications of someone who has hypertension.
No, they're independent of each other. Somebody who is hypertensive and has kidney problem and has diabetes, though these are all contributory to future events, to cardiovascular
events, heart attacks and strokes. No? I think also what Dr. Nick wants to emphasize is your goal is actually lower for this category of patients because they are what we call high-risk patients. Diabetes now is labeled as a cardiovascular disease, and therefore when one has diabetes, just by diabetes alone, he is labeled as somebody who's equivalent to have had a heart attack in the past. And therefore our goal blood pressures for them differ, so that 135 would be labeled as high for a diabetic, or somebody who has a chronic kidney problem for whatever reason, because interplay of organ systems, the kidney and the heart. So we take special attention for this special population. So what he's saying is that the 140 over 90 is not always the goal, and that for special populations, it might be even lower.
You mentioned special populations. Does it differ with men and women?
Actually, no. It doesn't in terms of level, no, or range. In terms of comorbidities, only comorbidities including, as we said, diabetes, kidney disease, and those who've had previous heart attacks, previous strokes, or previous cardiovascular events, male or female.
Okay, so it doesn't necessarily hold true that if you're male, you're more prone to this, to hypertension, or if you're female, you're not as prone as the male population.
Both male and females are actually prone to heart attacks and strokes. It's just that males tend to have it earlier, while females tend to have it usually like 5 years after menopause.
That's in terms of cardiovascular disease, but hypertension per se.
Oh, hypertension per se.
Not necessary.
At any age you may have hypertension.
Okay. So we'll go back to this, the signs and symptoms and the treatment and the types or classifications of hypertension. We'll just have to answer a Facebook question, doctors. From Rommel, my mom has hypertension. Is it possible for me to inherit the condition from her? So is it genetic?
Definitely, Rommel, no? You have 50% the likelihood of developing hypertension if your mom is hypertensive and your dad is not. And if your dad and mom are both hypertensive, then the incidence is even greater, no? So family history plays a very, very important role in developing hypertension. Of course, there are other factors to consider, but yes, if you're asking, you may develop. The likelihood is great.
And for someone who knows, yes, go ahead.
Anything you can do to prevent this or delay it? Well, lifestyle change, which means regular exercise, at least 30 minutes every day. It used to be advised that they would have exercise every other day, then it became 4 times a week, and now the emphasis is on 30 minutes daily. That's one. Low salt diet, which is maybe a problem among Asians because of our patis and bagong and
toyo and all of the condiments.
Yeah. And of course, if he's a smoker, he has to stop smoking.
So it's a complete lifestyle change for one who already is predisposed to having hypertension.
There is a term called DASH, D-A-S-H. It's called Dietary Approaches to Stop Hypertension. So aside from what he said, it includes alcohol in moderation, exercise, weight loss, no, trying to achieve ideal body weight. No? There are even specifics on how much salt they allow us to use. A teaspoon of salt the whole day. So that's about 2,600 milligrams or 2.6 grams. And then a low salt would be about 1.5 grams. No? So there are ways to really try and prevent it. And if you are predisposed to it, then we advocate, we admonish sticking or adhering to that. No? Moderation in alcohol means 1 glass of wine for us women, or a bottle of beer, and 2 hard drinks, or 2 bottles of beer for men. But this is nightly, and no accumulation. So if you didn't drink the whole week, you'll say, "Doc, I didn't drink the whole week. Can I make that?" So nothing of that sort. No. So
you
these are all
that.
these are all included actually in maneuvers to try and prevent hypertension.
Okay. We'll go back to more of that. Doctors, another question from Facebook, from Angela. I've had several vertigo attacks. Could this be a sign of high blood pressure?
This is something I see frequently in the clinic. They would come in because of dizziness. They would say, "Doc, nahihilo ako." So I asked them to describe the symptom. No? Do you feel like you're floating? Do you feel lightheaded? Or do you feel like your surrounding is swirling? And when they say their surrounding is swirling, and that must be vertigo. And then they said, "But my usual blood pressure is 110, and then when it becomes 130, I start feeling something." So I always correct them, try to correct them at least, that sometimes it's what you feel that makes your blood pressure go up. So it's not necessarily that you are hypertensive and that makes you dizzy. Rather, the dizziness makes your blood pressure go up, which is a natural response. So very important, again, is to establish whether you have high blood pressure in a relaxed environment, at least 2 episodes, 30 minutes without anything like that. And then that may label her as having high blood pressure. So get rid of the dizziness. You may have to take some medicines to get rid of the vertigo, and then have your blood pressure checked. Doesn't always mean that if you're dizzy, you have high blood pressure.
Oh, you don't associate it right away with
As a matter
high
of
blood
fact,
pressure.
most hypertensives would not have any symptoms.
That's the essential classification of someone who has high blood
Hypertension
pressure.
in general, Lenny.
Yeah, 70% of patients with hypertension are actually asymptomatic, no symptoms. No, that's why they call it the silent killer, because it can just get you anytime, particularly have a stroke when your blood pressure is high, not necessarily having symptoms. No, essential hypertension is actually the label, or primary hypertension, or essential hypertension is the label for the most common type of hypertension, not due to any other cause, not due to a kidney problem, not due to any specific abnormality, but it's labeled as essential when there is no predominant primary cause. Okay, so that's how you call hypertension essential.
So we'll go to the causes and symptoms and possible treatments for one who has hypertension when MedTalk returns. Sorry, Doc, I had to cut you. Did you know that the Rotary International in Great Britain and Ireland hold the most number of blood pressure readings in 24 hours in April of 2003? The total number of people who participated reached 127,573 at over 1,000 sites across the United Kingdom. Hypertension causes 62,000 deaths in the UK every year. We're back here on MedTalk and still talking about hypertension. We have a caller on the line, Lance Christoph from Taguig. Hi, Lance. Good evening.
Hi.
Yes, Lance, a question for our doctors. You have a question for them?
Hi, Miss Angel. Doctors?
Hi.
Yes, I do. Doctors, you know, I'm in a very stressful environment as a salesperson.
Yes, Lance, go ahead.
Does low heart rate, does it mean that I'm a bit safe from having a hypertension?
You said low heart rate. Low?
Yes, Doc.
Yeah,
Low heart rate.
may I answer it? No?
Sure.
Yes.
Low heart rate usually is actually a good sign. Now, most people who have low heart rates, we see this more commonly among athletes, which means you probably are physically fit. The heart rate is not related to blood pressure. It's actually the high heart rate or high pulse rate that is related to high blood pressure. Are you athletic? Are you the gym type of person? Probably.
I do a lot of walking every day.
That must explain it. That's actually a good sign. Most of the time, most of the time. Of course, there are people who have very low or too low heart rates and they may feel faint. If you feel faint, you feel like you're about to lose consciousness, you feel cold, clammy sometimes, then your heart rate may be too low. But most of the time, low heart rate is good. Okay, Lance?
Thank you, doctor. Yeah, can I ask the second question?
Sure, sure.
Go ahead, Lance.
So how reliable are the gadgets, let's say, versus the manual taking of the blood pressure?
Well, you're usually what you use at home are the digital, right, Lance?
Yeah.
The digital gadgets that you use. They're actually good because they're for home monitoring. They usually give us an idea, better than no idea at all about your blood pressure. There is a list in the internet of accurate gadgets that have been internationally accredited to give us a more reliable blood pressure than some gadgets that have not been had not been checked. No, I don't want to mention any brands, but there are. They are pretty reliable, but usually they have about a 10 to 20 millimeter difference, plus or minus, with the gadgets that we use in the clinics, the manual ones. Of course, it's more reliable when a doctor or a human being manually listens to the heartbeat and gets the blood pressure. But as a guide to monitor, I think it's pretty okay. What we usually do is we try to calibrate it against a manual blood pressure. What I usually tell my patients is if they feel that their gadgets are more than a year old particularly, and they're not calibrated against a mercurial before and now a manual, even a manual digital. So I tell them to bring their gadgets to the clinic. I think you do too, Nick. And we take the blood pressure. After we do, I let my patients show me how they take it to watch their technique, and we can compare the blood pressure. Of course, the blood pressures that we take in our clinic, we feel are more reliable because these are taken by your physicians. So we're able to check. But as a rule, if you change your battery, your gadgets are pretty new. That means they're less than a year and bought from a reputable or an internationally accepted branding of your gadgets. You can use them as home monitors, and that should give us a pretty good idea. What I let my patients do also is to take it twice. Don't take just one. You take them a few minutes apart. If the first and the second readings are pretty close, then you know by average they're reliable. If the first and the second are really discordant, far from each other, you take a third one to get an average. Chances are, if it always does a first reading that's really far from the second, then chances are your gadget is not really very accurate. It's time to change it or have it calibrated, right, Nick?
All right, Lance?
Yes?
Lance, I hope our doctors were able to answer your questions.
Yes, they did.
Okay, great. Thank you very much for calling.
Thank you.
You're welcome. Okay, Doc. So we go back to the causes, signs, and symptoms briefly of someone.
As I've told you earlier, most of the time there are no symptoms of high blood pressure. And this makes people more prone without knowing that they are candidates for cardiovascular events in the future. Then who should have their blood pressure checked? Anybody, but at age 20 at least. Of course, in the pediatrician's clinic, the pediatrician should take the blood pressure of their patients. At 18, they are not pediatric patients anymore, technically. So at 18, have your blood pressure checked. If it's normal, then have it checked at least once a year.
Okay.
To know whether you have high blood pressure or not. Following the same protocol, which is well rested, no smoke, no coffee for 30 minutes.
How about, for example, when one is about to work out? And maybe you're excited, you're nervous, or any other emotion that goes into that, and someone takes your blood pressure, or maybe the gym takes your blood pressure, and it's very high. Should you still engage in that sports activity?
Well, there are physiologic rises in blood pressure: excitement, anger, happiness. These are active situations in which the blood pressure may elevate. And I think I always tell my patients it's more abnormal that you're excited and happy and your blood pressure does not move. No, it doesn't react. But then it should go down when the emotion has
maybe
stabilized,
while you're doing the activity.
So exercise per se, before an exercise, unless you're really excited to do the gym workout for that time, should not necessarily cause elevation of blood pressure. So it might be emotional in that case, no? If it's screening, but of course if you're a known hypertensive, that's a different story altogether. If you are hypertensive and your blood pressure is high before you engage in exercise, then it might be time first to have a reassessment with your physician to evaluate if your medications are still good. You have to remember you haven't engaged in exercise, and any form of strenuous exercise can put you into a cardiovascular event. No? So it should be always stable before, during, and after exercise. Although exercise may cause a decrease or an increase in blood pressure, but this is normally after the exercise, not before the exercise. No? So having a blood pressure elevation before even engaging in exercise is something that we may need to evaluate.
There are also other types of hypertension.
Yes, Doc.
One of these is what we call white coat hypertension. White coat. When they see a doctor or they are in the doctor's clinic, their blood pressure tends to go up because of anxiety or fear or whatever nervousness maybe. There's also, other than white coat hypertension, you also have pseudo hypertension. No? Pseudo means you are not really hypertensive, but you are hypertensive because of some events. Or maybe you are taking some substances that may cause hypertension. What I think wanted to talk about was pseudo-resistant hypertension. No? Pseudo-resistant hypertension is when your blood pressure is not well controlled. Pseudo, but it's not really not well controlled. It's because probably you are inadequately medicated, probably you're taking it at the wrong time of the day, probably you are not taking the right dose, or probably you're not taking enough medications. So that's called pseudo. The other point I want to raise is the issue about resistant hypertension. You have a patient who cannot reach a target level of less than 140/90 with so many medications already, you know, and that is called resistant hypertension. And people with resistant hypertension have a higher risk for complications of hypertension, which are mainly heart attack, heart failure, strokes, and kidney failure.
Is that your specialty also interventional?
Well, lately there's some
Cardiology.
excitement in the interventional field of cardiology because we now have a gadget that will help medications control blood pressure. Medications most of the time would be able to control blood pressure together with lifestyle changes. But there's a new gadget now, it's called RDN, or renal denervation therapy, no, that can burn or zap the sympathetic nerves, what called sympathetic stress nerves that come from the kidneys, that also stimulate the brain, and this will break also the cycle of the brain sending stress levels to the kidney to sort of malfunction and produce high blood pressure. This is something new, something exciting, and the results have been very encouraging.
So this is for the patients who
are
already
resistant.
resistant.
It's a smaller percentage of patients. Generally, we'd like to think that our control is pretty fair, although compliance to medications and stuff like that are not exactly good, but only in really very adequately treated patients, and they still refuse to, the BP still refuses to go down. Would
Compliance,
compliance
can be a problem.
Consideration.
We'll go back to that compliance and then what happens to individuals who may have hypertension already and then they stop their medications because they feel that they don't need it anymore. After our tweet from Sheila, I have plans of getting pregnant, but I am suffering from hypertension. Can this affect my pregnancy? Doc Nick, Doc Lenny?
Definitely, no? Definitely, Sheila. If you are hypertensive before you get pregnant, you have to ensure that your blood pressure is well controlled before pregnancy. If you are hypertensive before pregnancy, definitely you will be hypertensive the rest of the way, no? And this is a situation we call chronic hypertension, as compared to you get pregnant and you develop hypertension, particularly after the 20th week. So 20th week is about
4 months.
the second trimester of pregnancy, and you are labeled as having gestational hypertension, or what we call pregnancy-induced hypertension. Again, this is common, or as the term is, it only happens when you are pregnant already. Okay, so but Sheila's question specifically is if you want to get pregnant, there are medications that your OB-GYN and your cardiologist will probably shift you to when you are pregnant. These are medications that are safe for both the baby and you. And there are certain medications that are a definite no-no to pregnancy, so I will not say them on air anymore. But the most important thing, Sheila, is that you consult both your OB-GYN and your cardiologist, because there are medications that are very commonly used that may be teratogenic, meaning bad for the baby. And in the first 3 months of development, when the organ systems of the baby are being developed or being formed, it can prove to be detrimental for the child particularly. So planning is good. So you have to consult. So you plan it well, you plan it with your internist, cardiologist, and you plan it with your OB.
And speaking of planning, briefly, any type of diet, not necessarily a diet that, the diet that we all know, but, a lifestyle change in what we eat and what we should avoid.
You actually
Avoid
started.
salt.
You actually started
Avoid
already,
salt,
by saying sodium.
Sodium.
Primarily for diet. It's
Yes, for
really
hypertension, it's really.
And then get a lot of fibers. That will help also. What
Green
they
leafy
call
vegetables.
the Mediterranean diet. Nuts and yeah, nuts is good also because
nuts and
avoid
wheat,
animal fat.
Animal
fat. That's primarily the source for cholesterol, or what we call the bad cholesterol. I think basically it's really sodium, no? So sodium, not in just salt, bagoong, and patis, as Nick mentioned earlier, but it's processed food, no? Canned food. Anything in
in a package.
In a can or canned is salted.
And preserved.
Preserved kasi siya. Processed foods, bacon, sausage, hot dog, which we all love.
Yes.
Okay. And exercise. Exercise has been proven to control blood pressure adequately.
So exercise and the right diet, and of course,
and the restful sleep.
Restful sleep. That's really,
That's
really
what you were
important.
talking about earlier in your spiel. It's the stress, really. Although stress is not labeled as a major risk factor for cardiovascular disease, we all know that stress causes a lot of things. It causes stress eating. People use stress as the reason for smoking, as the reason for drinking, as the reason for inability to sleep. So getting good rest, clearing your mind of stuff, trying to chill is always a good advice for blood pressure control.
Thank you very much, doctors. I know the topic was hypertension, but you helped me and our viewers just chill and understand it a lot better. Thank you very much once again.
Thank you, Angel.
A gentle reminder to our viewers, it's important to check our blood pressure on a regular basis. Again, I'd like to thank our doctors for enlightening us about hypertension. Once again, thank you, Dr. Maria Adelaida Iboyon D. and Dr. Jose Nicolas Cruz. See you again next Tuesday on MedTalk as we talk about dengue. 10 p.m. on your scheduled on-air consultation on the Solar News channel. This is Angel Jacob. Good night.